My name is Dr. Jennifer Pavlov. I'm the owner and Pavlov Chiropractic here in Marysville. I went to Marysville High School, and then I went on to Ferris State University for my bachelor's degree, and then I went down to Life University in Atlanta, Georgia for my doctorate degree. Okay, so this is the best way that I've been able to explain chiropractic to my patients. I pull out this plastic spine model and I say, as a chiropractor, I mainly concern myself with the structure of your spine. So I want to make sure that all these bones or vertebrae in your neck and back are in their proper alignment. Because when those bones are where they're supposed to be, it allows these yellow guys here. These are the nerves that exit out between each of the bones. It allows the nerves to function at their best, or at 100% we say. So it's really the nerves that I care about, or any chiropractor cares about. The reason we care about the nerves is because they're part of your nervous system, so your brain and your spinal cord. Your brain and your spinal cord control everything in the body electrically. So not only your pain-sensitive parts like your skin and joints and bones, but also your non-pain sensitive parts like your organs and your glands and your special senses. All of it's controlled by our brains through these nerves or through your nervous system. Now, the neat thing about your nervous system, it was the first system that was created when you were in the womb. Everything else was quickly orchestrated around it. And it's the last one to go before you die. So if you lose function of your heart and lungs, but if you still have brain waves, you're still technically alive. And it's the only one encased in bone, or all these vertebrae in your skull up here. Now, your skull is pretty well fused, so we don't adjust that very much. But these bones are all interlocking, and they're on top of each other. They're stacked on top of each other, and they're movable. So, that allows you and I to do simple things like turn our head, bend over to tie our shoes. But we can also do things like carry our kids too long on one hip, or our backpacks only on one shoulder. Or we can fall down the stairs, or we can crash our cars. Whatever it might be, now these bones can become shifted and stuck out of place. Now, when that happens, it starts to close down on those little windows that those nerves come out of. So now say, for example, that nerve there. Whether it's going to your stomach, or it's going to your sinuses, or it's going to the muscles of your lower back, now it's going to cause some type of pain or some type of symptom, because now that nerve is getting choked off. It might be squashed and compressed, it might be stretched and twisted. It's just not happy anyway, and it wants to get your attention, and that's where I come in as a chiropractor. So once I put the proper motion back into those segments, we call them subluxated segments. So that's what I do. I correct subluxations in the spine. Once I do that, it takes the pressure off the nerve, and it just allows the body to function better naturally. It's not about putting anything in or cutting any organ out. It's just about relieving pressure off the nerve and allowing the body to function the way that it was meant to be. Okay, so your teacher's given me some questions that you guys had for me. We'll dive right into them. So the first one is your job ever challenging? Yes, it is at times, mainly with insurance companies, jumping through the hoops that they want you to jump through in order to get paid for what you do. And every now and then you'll have a difficult patient, someone who comes into the office that doesn't really feel like they need to be in the office. Maybe their loved one is really pushing them to come in, they think that they need it. So things like that, but generally once people get adjusted, they fit right in and they feel better, and so it's not too much of a struggle there. I'd say about 8 out of 10 cases resolve in my office, and every now and then I'll just get that tricky one that we need to delve either further into, or maybe I need to refer them out. So. Number 2, why did you pick this as a career? Honestly, it makes too much sense to me. I just believe in the healing powers of the body, and that honestly our bodies are way smarter than we are, quite frankly, and so it's not about adding things in. Sometimes it's about just freeing up and allowing the body to just express itself better. I feel that true health doesn't come from a pill bottle or removing an organ that you were born with, perhaps. I want to amplify my own body's healing capacity through optimum nerve flow, optimum communication from my brain to all my parts. And so that's what I like to do with my patients too. What kind of treatments do you do in this field? The chiropractic adjustment. I use my hands to do it. I also have tables that the patient lays on that I use the table also to assist me. Sometimes I use instruments or handheld tools to help me along with the adjustment for those hard to reach places, or maybe like babies or the elderly. The adjustment sometimes makes a noise, crunching or cracking, people refer to it as. I always tell people if we cracked people's bones, they wouldn't come back. So we don't break bones, that noise isn't joints dislocating. It's really not what we're going for at all, but what it is it's a gas that's being released within the joint. So all of your synovial joints, like your elbow here, all the bones in your spine, have a fluid called your synovial fluid, and it's kind of like champagne, like when you take the cork off of a champagne bottle, it makes a loud popping sound because there's gas built up within the bottle. So the same thing is within the joint. If you take the joint to a certain tension, that gas escapes, and that's the sound that you hear. If you waited 20 minutes and that gas settled back down, you could do the exact same thing. So again, it's not what we're going for. We're going for more joint motion and relief of the pressure off of the nerve. So how much schooling did you go through? I went through 4 years for my bachelor's degree, and I went to Ferris State University for that. I got a bachelor's in applied biology. If I were to do it again, knowing that I'm a business owner, I'd probably get a bachelor's degree in something like accounting or business, just in hindsight. And then I went down to the prestigious Life University in Atlanta, Georgia for 4 more years, and I got my master's degree and my doctorate degree from that university. I didn't have to get my master's degree, but I chose to. Some states require that you have a bachelor's degree before you enter into chiropractic school. Not all states are like that though, every state is different. Was the program hard to get into? I want to say no, it wasn't. There are prerequisites that are required to get into a chiropractic program. There are 13 schools throughout all of North America between Canada and the United States. As of right now, there is no entrance exam to get into chiropractic school, but again, there are prerequisites to get in, and I feel like as long as you've got those covered, for the most part, you're good enough to get into the program. Now, it's not to say that everyone who gets into the program finishes though, so. Has a patient ever physically harmed you? No, never. That was easy to answer, so. How do you balance work and personal life? Good question. I go home and I love up on my babies. When I'm here, my mind is here and I focus on work here, and when I'm home, I focus on my babies. Sometimes just being the owner of the practice, you've got to take home paperwork, or you've got to keep up on the finances of the business, that sort of thing. But normally I just do that after they're all in bed, and it's fun because it's your business, so it's not like it's work at that point. Any tips on adulting? It should be fun. Don't put things off if you can help it. Get it done right away. Be that person who starts off their day right. Make your bed, wash your face, put on a clean set of clothes. Take pride in your work. Don't be a slacker, make excuses. And don't be quick to react. If someone does something kind of harsh to you, don't be quick to react to them. Sometimes it's a much bigger reflection of them than it is of you. Next one, how much money do you make? I'll say this, a lot, and I'd like to make more. According to Chiropractic Economics magazine in 2019, the average total DC compensation, so not only their salary but maybe any bonuses that they got too, was $123,435. So it's a good living. What is the least favorite thing about your job? I would say doing paperwork and missing my babies. If I could adjust with my babies running around on the floor, that'd be pretty great. But yeah, having to be away from them, and then just the paperwork part of it. Have you always been in the medical field? No. I worked in pharmacies when I was in high school and in college, but that's as close to the medical field as I got. Do you ever regret what you are doing now? No, never. I very much like what I do. I couldn't really imagine myself doing anything else. I don't really care for student loan debt that follows you out of school, but it is what it is. If that's what I had to go through to be able to do what I do now, then I'll take it any day. What is the most rewarding thing about your job? I would definitely say seeing the relief that it gives people. You know, when people come in and they're hurting and you can just see it through their mood, and then they start feeling better and they are smiling more and they're talking more, they're opening up to you more, all of a sudden, just because their body isn't in pain and you were an instrumental part of that, it's a really, really cool thing. Next one, is it hard not to breach HIPAA? I would say sometimes. So, you know, HIPAA is where you just really have to be careful about how you keep patients' information private. Now, I live in the community where I work, and I like to go out and about, and I genuinely like my patients. So if I see them out and about and I'm with my husband or with my family, I'd like to acknowledge them. I'd like to say, oh, this is so-and-so, and I see them at the office, but I can't do that. So so that part is hard of it. But otherwise, no, I mean, like, we've got a pretty good system down to keep everything, you know, concealed in the office, and so that part isn't hard at all. What soft skills are required for the job? I would say being approachable, like someone that you've never met before would come in and trust you to talk to you about some of their sometimes intimate problems, and trusting you that you can take care of them. That's a big part of it. Also empathy, being caring, open-minded, being a thorough problem solver, things like that are all really important. How do you deal with difficult patients? I thought this was an interesting one. So I broke it down into two parts. I said, a difficult attitude is one thing. I approach it head on and with confidence. I feel like people respond best when you show that you know what you're talking about, and confidently. And if they don't, then they don't really want to be in your office, and they'll find where they need to be. Or maybe they don't really want to be out of pain, and you'll find people like that too. Sometimes you'll have just a difficult case though, you know, where someone wants to be in the office, but they're just not responding well to the care that you're giving. With that, I approach it with persistence and encouragement. I'll say things like, you know, I've seen this before. This is how the body heals. It just takes time. Sometimes giving comparisons is a good thing. Like, you know, if I put braces on your teeth today and I took them off tomorrow, would your teeth be any different? No. And so sometimes it's a good just visualization in a person's mind about, like, okay, this is how healing takes place. Sometimes when people take an aspirin and their pain goes right away, as soon as the aspirin wears off, they've got to take another aspirin. I want to get to the point where if they don't come in for adjustments, their pain doesn't come right back. So that's where we're getting to, and that takes a lot longer sometimes than people want. Okay, next one. If you were to pick any career, what would it be and why? I'm guessing outside of chiropractic, but I would probably choose, if I was going to do something else with my life, I would probably be like a professional cleaner or a mail carrier, something like that, where I could like get outside and walk every day and just deliver people's mail. Or I like cleaning too, so probably like a cleaner. What is the most extreme case you've ever seen? I had a few. So I had a case once where I thought that a guy had literally dislocated his shoulder. He was in so much pain and he couldn't move his arm. It turns out that it wasn't his shoulder at all. It was his neck. And after 2 adjustments to his neck, he was about 80% improved. It took a lot of work, but it was pretty significant. He was very, very grateful. I had another guy who was in so much pain, he couldn't lay face down on my table. And so we actually had to adjust him in the fetal position on the floor. So that one was also pretty extreme. I remember him. And then I had another lady, when she started coming in, she was very, very sensitive to the touch. And she couldn't handle my hands being on her. I had to use a handheld adjusting instrument. And I actually had to adjust over my hand on her body because she was so sensitive to the touch. Now she can adjust with my hands, no problem, and she adjusts great. She's come a long way as well. What hours do you work? So I work 3.5 hours in the morning and 3.5 hours in the afternoon, 3 days a week, Monday, Wednesday, Friday. And I have a 3-hour lunch break. So that's pretty cool. And I'm open 2 hours on Thursdays and 2 hours on Saturday morning. So I think it's about 25 hours total that I'm seeing patients throughout the week. What types of patients do you care for? I mainly see families. I see a lot of the elderly. I also see a lot of kids. And we are also the chiropractor for the Port Huron Prowlers. So we see them as a hockey team. Next one, how do you respond to people who think chiropractic is not real medicine? I really appreciated this question because we're not medicine at all. We actually pride ourselves in not being medicine. Chiropractic is the study of health and what causes man to live, and medicine is the study of disease and what causes man to die. So I don't disagree that we don't need medicine. I certainly think that we need medicine for emergencies and whatnot, but if you really want health, you need to think of a different way of going about it than chasing symptoms. So I feel like chiropractic is simple. It releases nerve pressure, allowing the body to normalize just on its own. You throw in some nutrition, you talk about stress and sleep, and really you've just got the makings of a good practice right there. So that's what I would say. It's kind of like saying, you know, is a carpenter upset that they're not a firefighter, you know? No, because they're two different things. A carpenter is about building and maintenance, and a firefighter is about emergencies. And so I feel like that's kind of a good parallel for our two professions as well. Is it true that a neck adjustment gone wrong could paralyze a patient? My answer to this one is I could see how someone would think that, but I've never actually heard of it. Of course you see it in the movies, you know, Bruce Willis, you know, taking someone's head off or something, like really putting them down, but it's not what we're trained in. You know, our adjustments are very, very specific. You know, moving one bone millimeters at most. You're probably more likely to honestly get paralyzed from Guillain-Barré syndrome, you know, something like that people are exposed a lot more to through like maybe getting shots or something like that, and that's not even heard of very often. But even the New England Journal of Medicine cites 74 cases of that from 1993 to 1994. The reality is chiropractors have some of the lowest malpractice insurance rates because we are so safe. And the next one. What are the benefits of chiropractic and what conditions do you treat? Honestly, I like to say that chiropractic doesn't treat anything. It just allows your body to heal and function better and works over your nervous system, so really the possibilities are endless. I've seen it help with low back pain, sure. I've seen it help with headaches, sure. But I've also seen it help babies walk. Yeah, I had a baby one time who was really delayed. Her parents took her to the doctor. They were throwing around the word cerebral palsy for a while there. Anyway, we got her adjusted, and literally the next day she started walking. Now, it may have been coincidence, but I like to think that maybe somehow her nervous system was just kind of preventing her from doing that. I've seen it relieve foot pain in patients that never even mentioned their feet. I've seen it help digestion, menstrual problems, constipation, sinus issues, trouble sleeping, asthma, ear pain, numbness, tingling, TMJ issues, balance. I've personally seen all of these things helped with chiropractic, but there are some really cool cases that chiropractors before me have seen. Actually, the very first adjustment was given by a man named Dee Palmer to another man named Harvey Lillard, who was a janitor at some building out in Iowa, and it helped Harvey restore his hearing. He was not born a deaf person, but he acquired it throughout his years, and his adjustment allegedly helped restore his hearing. So anyway, those are your questions. I appreciate them and hope they helped you out.